Okay, good morning everyone. Welcome to our event today, Safe Reopening of Retail, focused on businesses in Warwickshire. This is another in our series of webinars aimed at supporting businesses and organisations with information as we follow the government roadmap out of lockdown. The next step comes next week, commencing 12th of April, when businesses providing so-called non-essential retail will be among those able to reopen. Hence, we're hosting this recording today to help with information, answer questions you may have, and provide support to you. This morning, we'll provide a brief overview of the current COVID picture in Warwickshire, some general public health advice to retail, and information on local lateral flow testing and contact tracing. This webinar is brought to you by safety and regulatory colleagues from local borough, district, county councils and Warwickshire Police. And many thanks to our partners who have helped us to plan and promote this webinar today. Please note that the event is being recorded, so should you remain logged in, we take this as your consent to take part. The information provided today is current and correct to the best of our knowledge on the 8th of April 2021, so please note this if you're viewing at a later date. In terms of the format this morning, our panel will introduce themselves, we'll view some key public health messages, and then we'll move over to some pre-submitted questions and questions from you. You can raise your hand or submit your questions via chat at any time. My name is Ian Flynn and I work at Warwickshire County Council, and I will be your facilitator today. So I will now introduce our panelists, starting with Gemma.
Oh, I was having problems with my mute button then. Hi everyone, so I'm Gemma Stainthorpe and I'm Health Protection Programme Manager at Warwickshire County Council in the Public Health Unit.
Thank you. And Jonathan?
Good morning everybody, my name is Jonathan Toy. I'm the Group Manager for Trading Standards and Community Safety for Warwickshire County Council, and I've been part of a collaborative joint regulatory meetings that have been taking place since the regulations came into force back in March 2020.
Thank you. And Aaron?
Good morning everybody, my name is Aaron Coursey. I head up the Town Centres and Tourism team at Warwickshire County Council. We've been helping to support the districts and boroughs with their safe reopening, as well as running the Warwickshire Towns Network and coordinating volunteers and champions across the towns.
And Henry?
Good morning everyone, my name is Henry Biddington. I'm Principal Environmental Health Officer at Rugby Borough Council's Commercial Regulation Team. I've sat with Jonathan and as the regulators across the county on our COVID intelligence and regulators meeting since the start of the regulations, here to offer any help and assistance for businesses in a safe reopening.
Thank you. And Helen?
Yeah, hi everyone, my name is Helen Ashby. I'm Food and Safety Officer at Stratford District Council. I'm part of the working group with Henry, Gemma, Paul and Jonathan, and we're responsible for enforcing the COVID regulations at local businesses.
Thank you. And last but not least, Paul?
Good morning everybody, Sergeant Paul Calver from Warwickshire Police, working within the COVID cell within the police and working with all the partners here today for the last 12 months plus around COVID, so welcome.
So thank you, that's our panel. So I'm going to ask now Gemma just to give us a quick overview of the current pandemic situation in Warwickshire and some key messages from public health.
Sure, no problem. Okay, so hopefully you can all see that graph there. Okay, so just looking at the current situation, it's always good to paint a picture of what things are looking like with regards to COVID cases. So this graph here shows our rolling rates per 100,000 population of positive COVID cases. So the different colours represent the different district and boroughs within Warwickshire. So you've got pink being North Warwickshire, purple Nuneaton and Bedworth, green Rugby, and then sort of dark blue Stratford-upon-Avon, yellow Warwick, and then the light blue represents the trend for Warwickshire as a whole. So if I just highlight there on the right hand side, you can see that the rates per 100,000 for Warwickshire sort of averaged at the moment sitting around 45, which is really good, and we're coming down nicely. Obviously you can see the trend there from our large peak in over the winter months, and now we're coming down very nicely here. Obviously, as you can see, the different districts and boroughs do vary. We've had a spike in North Warwickshire, who are currently averaging around 93 per 100,000. So there was a little bit of a blip there, but we're hoping that that is now coming down to come in line with the rest of the district and boroughs. So you can see there the various kind of rates that we're looking at, but this lovely downward trend, which we're hoping to continue with, is evident there. So that's just a general picture of what things are looking like there. I have another one I wanted to show you. Hopefully it'll load. It does take a little while to load sometimes. Okay, here we go. So this is just to give you a bit of an idea of the pattern of where the infections are hitting. So this top heat graph here, you've got the darker colours showing the increase in cases, so the higher number of cases, and this is going all the way back, you know, through to April last year, and you've got through the winter months here, it was December, January, February, where we really started to see that peak of cases. On the left hand side here, you can see the age categories that are being hit. So we can sort of see, looking at this dark heat map here, it was affecting really the working age population, so the people who were still having to work during that time. If we were to come down to the bottom one, this shows the last 3 weeks, looking at the heat maps here. So we're sort of looking from March the 14th here, and then into the end of March, and then the beginning of April. We can see in the 10 to 19 age group there was a particularly strong trend of increased cases, and naturally you know, that has aligned with the return of schools, so it's just kind of following a pattern that we weren't surprised about really, and then potentially some knock-on effect into the parental age groups there. So that just gives a picture, hopefully. Oh, I can stop sharing my screen. There we go. So that just gives like a basic overview of COVID cases at the moment and what it's looking like. So my next point was, I've just reviewed the guidance looking at retail reopening next week, and there have been some key places that I wanted to bring your attention to. So the main change that we're looking at is we're looking for really premises to take sort of control of ventilation and really maximise that within their establishments. So we know that the Kent variant of COVID, which is the most dominant in Warwickshire and across the UK, it tends to travel, you know, quite a lot on fine aerosol particles. By increasing ventilation of our spaces, we allow those particles to move on and become diluted. So we're asking businesses to think about the mechanisms of ventilation for your premises. So could be things like mechanical ventilation, so with fans and ducts within a mechanical machine, but just sort of making sure that it's new air that's being ventilated and circulated rather than, you know, old air going from room to room and things like that. And then the other, you know, very, very obvious one is passive ventilation. So that would be opening windows and doors to allow the airflow through. Both are really, really effective against that variant. So it's, you know, it's really important to kind of think about ventilation moving forward. Another thing I just wanted to mention, actually linking into ventilation, I've been having a look and I can see now that within the guidance, changing rooms, fitting rooms will now be open within retail premises. So just again, really thinking about how to maximise ventilation through those areas. Are there nearby windows you can open just to get some kind of airflow going through? On the subject of fitting rooms, we're asking that people sort of consider really managing fitting rooms. So whether you put a person, member of staff on a fitting room and just kind of manage that flow, really sort of asking to be ever so careful with fitting rooms. So perhaps a one in, one out process. Hand sanitisers on entry to fitting rooms and then on exit as well is a really good way to go. And then with regards to fitting rooms, the guidance is suggesting that once a cubicle's been used, to leave it for, you know, roughly around 10 minutes or so before it's used again, to allow that airflow to go through, open the curtains and allow that airflow to go through before the next person goes in. And if you've got multiple cubicles, you could sometimes manage that by perhaps using one cubicle and then sending someone into another cubicle and really kind of spreading out that that flow. Obviously, we're asking people to go in on their own to the fitting room unless assistance is required. So unless perhaps in the case of with children or those with a disability. So just to be really mindful of that. So that's fitting rooms. The other thing I just really wanted to finish off on quickly would be testing. So just thinking about your staff. Obviously, everyone's going to be coming back into the retail environment, and there'll be a customer-facing role, be working with other colleagues, etc. So we're asking employers to ask their employees to be having 2 lateral flow tests a week. So these are the quick tests that are done, and you get your test result sent to you within 30 to 40 minutes. And we're asking for a couple of times a week because these tests pick up quite a narrow infectious period range. So by having them a couple of times a week, you would be, most in the know about what your current COVID status would be. There's a couple of ways you can go about ordering LFTs, and hopefully there'll be a proper link in the chat for you. There would be ways you could order LFTs through the government scheme to your business if you employ over 10 people, and it's best to get those orders in before the 12th of April, because then I think charges sort of come in to that. Obviously, I think there's 5 or 6, there's at least 1 in every district and borough of LFT sites across Warwickshire. They've got really long opening times, and again, a really sort of good way to do that is to direct staff there a couple of times a week. Perhaps that works better. There will come a point very soon where you can pick up LFTs from these sites, and we've got sort of better flow of those tests now, so we're able to offer that. It might be beneficial to do the test first at the site, your first ever test, if you've not done one before, just so you've got the technique right before you take it home, sort of next time. So that's my whistle stop tour of new bits that I've seen. Obviously existing bits are still there, social distancing, masks, etc. But I'll let other colleagues come in. Thank you.
Thanks, Gemma. So that's a really useful overview of some of the key changes. Perhaps we'll move now to some of the pre-submitted questions that we've got that pick up on some of those points raised. So you mentioned face coverings, Gemma, just then. So what's the current thinking on face coverings and visors? Do retail workers need to wear them?
Yeah, so with regards to face coverings, all retail workers will be required by law to wear a face covering unless they are medically exempt. If you are exempt, there are lanyards that you can get hold of to kind of demonstrate that, and badges actually in some cases I've seen sort of saying I am medically exempt, just to kind of really make that clear and kind of reduce that confusion. But yes, they are required. Visors, you're welcome to wear a mask and a visor if you wish, but the most important part for retail workers would be the mask, because obviously that's the sort of main route of transmission. Visors tend to be used in close contact services where people spend a long period of time close up to someone's face, just to offer that extra eye protection. And
can you tell us where those lanyards are available for those that are exempt? Because I know that creates quite a lot of anxiety for customers.
Sure, I will find the link and I'll pop it in the chat for you.
Fantastic, thank you. Paul?
Yeah, just to reiterate what Gemma's just said with regard to face coverings, obviously from a police perspective, one of the largest amount of calls we get from publics reporting premises for potential breaches is around face coverings, but whether that be staff or customers. So if the staff, like Jim said, are exempt, the lanyards are a great item to have, because it will reassure the customers and will prevent them calling the police potentially or reporting to a local authority what they perceive as a breach. So it stops the police turning up at the doorstep and things like that to check these things out. So face coverings are a must, but obviously if they are exempt, then please use the lanyards or the badges that are available.
Okay, yes, thanks, Paul. And Gemma, you've posted. Is that the only source, or are there many sources?
I presume there would be many, but that one's sort of nationally recognised as the one that people are wearing, that's most recognised. So I would encourage looking at that one. I will have a look if there are more, but that one to start with.
Thank you, Jonathan.
Yes, can I just want to add one other thing about face coverings, which has come up over the last few months since the Christmas period, and we've had the lockdown. A lot of investments been put into place in terms of screens, and a number of retail premises, including supermarkets and essential providers, have been under the impression that a screen around an area is sufficient to protect staff and protect customers. What we have tended to find with the new variants, and particularly the Kent variant that Gemma has been said, is unless the screen is completely blocks you from the worker and the customer, the staff and the customer, then it's not as efficient in terms of preventing spread for the new variants. That's because, as Gemma will have said, the new variant is actually on smaller aerosol droplets and can travel over a much longer period, over a longer distance. And many of the screens that have been put into place have gaps either at the side or underneath where payments can be made, and they are not a completely impervious and solid barrier. We've spent a lot of time during January and February getting supermarkets on board with this, and you'll have seen that there was a big change in supermarket staff in all public places, public facing locations, regardless whether they were screened. They were required then we wear a face mask, and that was adopted pretty much nationally. So if you have put screens in and there are gaps either side or underneath, our absolute strongest advice to you is to have staff to wear a face covering, regardless whether they're behind the screen or on the shop floor. Do not think the screen is a barrier with the new variants, because our experience is it's not.
So that, unless, Jonathan, you've got something like the old style post office glass to counter sealed screen with a hole underneath for transactions.
Yes, and with those type of screens, normally even they have a semi-barrier for those transactions. It's like a sliding mechanism quite often. Post office, bank, that kind of element. Some of the screens we found is that they have they're no more than 18 inches to 2 feet wide. So you can serve the customer from both sides, and so the point of where the goods are handed over and the payment is made, you've still got completely open spaces where people in relatively close proximity. They do not work in that way. I'm sorry to be so blunt about it, but as I say, there's a myth to bust here that just because you put a screen up of that nature, it's going to be preventative for the new variants. It is not our experience that it provides the level of protection that then people think that it does.
Thank you. So face coverings, and Gemma, thank you for clarifying that. So yeah, the main link for the lanyards is that first link. Okay, so that's face coverings for staff. What about face coverings for customers? What do you advise for in the situation where customers aren't wearing face coverings? I think we've unfortunately seen lots of those, and I guess some of those could be exempt, but certainly seeing a whole group of people in a shop, in a supermarket, not wearing anything. Aaron.
So I'm happy to start, and then everyone else can chip in. I think it can start with that customer experience. So as a retailer, as a non-essential retailer, it's about the connection with your customer, and you will have already done your risk assessment, so you will have worked out what the processes are for staff coming into the shop as well as customers coming into the shop, hand sanitizers on the door, how many people you're going to allow in, if anyone's waiting and queuing, etc. So actually having that positive attitude to your shop, you can talk to your customers as they walk in. Oh, have you got a face mask? Oh, you can't see you're not wearing it. Oh, and can everyone sanitize on the way in? And absolutely have that positive experience about the customer coming in. Welcome them into your store. You've been closed for a while. You may have been doing click and collect, but we're back to being open now. And this is the process that we're following, and all the staff know that. And it's just having that open communication, and you can then approach the customer and they can say, oh, I'm exempt. Okay. So you've challenged them, and then you can allow them to come into the store.
Okay, thanks, Aaron. Paul?
Yeah, obviously it's a legal requirement for the customers to wear face coverings in the public places, within retail and things like that. That's the first point. It's about having clear signage as well displayed at entrances of the premises to say face coverings are required. There's occasions where ourselves or our colleagues have been to premises where the signs aren't clear, they're not displayed, they're either too small or in the places where people don't see them, etc. As that reminder on the way in. We would ask, like we have with all retail, that they do challenge people where appropriate with regard to face coverings. We don't expect people to put themselves into any risk of threat or harm when they come to the challenge as such, but we do ask, like we would with any premises at all, that they do make that initial approach to people and ask them, and obviously report if they get any kickback or abuse back or anything from people. 99.9% of the public out there will conform to the requests as such, will wear face coverings. Some people will routinely just forget to put them on, and that gentle reminder works, having someone meeting and greeting people as they come in, especially if you're controlling numbers going into your retail. The same person can like Aaron said, there's the hand sanitizer, don't forget your mask, etc. But obviously, it is a legal requirement that people wear face coverings when they go inside the retail premises.
Okay, thanks, Paul. So people on the call are welcome to post any questions in chat or to raise their hand if they have any questions. But as there are none at this stage, we'll move on with the list we have. So Gemma, you touched on ventilation. We've got a specific example here of a small shop with limited ventilation, just a main front door and back door, and the windows, it says, don't open at the front. What should they do?
So I think obviously with the front and back door, I mean, if it's appropriate and thinking about fire safety, you need to double check this with your particular building. But certainly with the front door, I think you'll be able to wedge that open and allow some kind of passive airflow into the shop. At least, you've always got, even if the windows are open, you've always got a door. And research has been shown as well that even just a small gap is enough to kind of allow circulation of those particles and allow kind of that flushing through to happen. So I would encourage definitely to be propping doors open. I think a lot of people will become used to seeing that and will become used to kind of thinking, oh, I better put an extra layer of clothing on because when I go inside, it's still going to be a little bit chilly. But I think a lot of people will be used to doing that.
Yeah, unfortunately the weather's picking up, so that'll be easier.
Yeah.
Henry?
Yeah, just to come in on that point about ventilation. So yeah, obviously any airflow coming through is better than no airflow. So it is important to get that airflow coming through. And if you can't get a natural or a passive ventilation through, you may want to consider putting something more mechanical in. Although I appreciate there is a cost to that, and that might be out of your means. But what I wanted to also touch upon is not just the shopping area, so also your staff areas as well. Any break rooms or canteens or any areas back of house of the shop. You also need to consider ventilation in those areas, because you quite often find that those areas aren't ventilated because they don't have any front face or windows or doors going into them. So those areas for your staff protection need to be looked at as well. And I think that needs to be, you know, it's not just about the front of house within your retail premises. A lot of you need to consider those areas as well. And also, you know, we've said, you know, the legal requirement is for front of house staff to, or public facing staff to wear face coverings. I would strongly advise in part of your risk assessment that you have your face coverings on in your back of house areas to prevent transmission between staff and workforce within those back of house areas. Make sure that those are well ventilated and you've got controls within those places, because a lot of retail shops, it's not just about, you know, as I say, the shop floor. You need to control the flow of people and ventilation and face coverings, etc., social distancing throughout the premises, and that should all be part of your updated risk assessment.
Thanks, Henry. So I can see in chat, Salesh, did you want to come unmute yourself and put this question to the panel? It touches on what we discussed before.
Yeah, basically, as I said, from what I do, obviously, I'm health and safety inspector, so I'm sort of enforcement. So during the COVID pandemic, we've obviously had quite a few complaints, and obviously when I'm out and about as well, I see that there's quite a lot of people walking in retail shops and they're not wearing face coverings, and when they are challenged, and I've experienced it myself, they turn around and say, "Oh well, I'm exempt," but obviously that is open to abuse because it's not a legal requirement for you to actually carry any medical certificates and to prove that. I'm just thinking what's the panel's view is on that.
Yeah, thanks, Salish. Paul, you've got your hand up.
Yeah, we're exactly the same issue for police, with the same challenges and the same responses. Unfortunately, or fortunately, it depends on the way you look at it. We're not going to delve into people's medical history, asking them to tell us about it. At the end of the day, as police officers, we're not doctors or medical experts, same as in the retail, not medical experts. Unfortunately, you have to take it on face value of people. If they say they're medically exempt, they're medically exempt. We're not expecting people to ask any more further questions than that. It's down to trust, really, more than anything else, of the people that you're asking. Hopefully there will only be one or two that actually use it as an excuse. Most people who won't wear a face covering because they don't believe in COVID will actually say that's why they're not wearing it. I don't believe in it. It's a conspiracy or whatever, rather than using the medically exempt rule. So, you know, we just have to take it on face value and trust people, and, you know, and try not to challenge them too much, because at the end of the day, if they have got medical conditions, that may be something like anxiety or a mental health condition that means they can't wear the face covering. And if you start questioning them about that, you can imagine the position you put in their mental health in as well. So, you know, accept it, move on is the best advice I can say to people.
Okay, yeah, that's good. I mean, also what I tend to see quite a lot of when I'm in supermarkets is people congregate in groups of 3s and 4s. They might meet somebody, a colleague or a friend, and they basically stand around having a chat.
Yeah, certainly in the larger supermarkets. Yeah,
I'll come back on that one as well, Ian, as well. I mean, on that front, I know in larger retail supermarkets and things like that, they do regularly put PA announcements out about asking people to socially distance, not gather, etc. If you're in a smaller retail establishment, then you will have less people in your shop anyway, because you'll be controlling the numbers, etc. And you should gently encourage people not to gather. If they're in the household group, they're in the household group as such. But if they're meeting other people and starting to chatter, then gentle encouragement of them not to do that. Because at the end of the day, if they're chattering in your retail premises, that's less people being able to come in to actually do their shopping as well. So it's about gentle encouragement. It's all about encouragement and education of people. That's the best way to try and deal with this.
Okay, and one final question is, again, I've experienced it quite a lot, particularly in supermarkets. When you go and use a sanitizer, sometimes I'm convinced they're actually watered down. They're like very, very runny, very liquidy, and you notice the difference as soon as you put it on your hand and when you take it out of the container.
I was just wondering if that could be something perhaps that the prevent and response team could look at, Jonathan.
I think it's the practicalities about how you do it and how you test it, isn't it? I think we've got to be realistic on what it is we can and can't do. You know, I suppose my view would be just to keep the dialogue going with the supermarkets and the businesses, and do it in a way that is both supportive but challenging. You know, and from the perspective of what are they doing to keep their staff safe as well as their customers safe. You know, so if staff are aware that hand sanitizers are being watered down, actually there's an impact on staff, because you know they're the people in the store most of the time. So I think my view would be, you know, there's no way I can think how the team could actually test them, but I do think, you know, the regular dialogue, the constant dialogue, the importance of supermarket or any of the businesses, non-essential is what we're talking about today, but any of the businesses, of understanding that wider collective responsibility is going to be fundamentally important. You know, as of the 12th, a whole range of different retail premises will now be able to be open. And that doesn't just mean clothes shops, it means gift shops, it means homeware, it means market stalls that weren't previously there. They can all be reintroduced to that shopping environment, and there'll be a lot of competition for space in the public domain. You know, but a lot of customers who will want to visit a number of shops, not just one shop, in our busy high streets. So it is about understanding how your premises, how your business operates within the environment of the town or the location that you're set in, and the steps, including hygiene, PPE, social distancing, but also the steps in terms of how you manage the area outside of your premises, the queues that might build up. If you're limiting, say, 2 or 3 people into the shop, what happens to the people who are then waiting? How will you manage that? Number of our retail premises, non-essential retail premises, have tried to find different ways of operating over the last few months, in fact over the last year. For example, there's been a big move to click and collect. Some of that's been really popular. It's gone down very well for some of our non-essential retail, particularly homeware and fashion wear and some of the gift shops. Are you going to continue operating a click and collect when your premises is open? And if you are going to continue to operate it, how will that work in terms of the space of your premises? It's a really important thing to consider, because you may not want to abandon what has become a really positive way of doing business, but at the same time you still want to have that customer experience of people coming into your premises. A number of premises have diversified in order to keep their business open. So we have seen non-essential retail who have been involved in one core element, then actually doing other types of services as well, or other types of provision. And I think for those non-essential retail that have been trying to do that, what is your core business and how will you move back to that core business if that's your intention? Because these are all the challenges that we're now going to face. Our high streets, when they reopen, will not be like they were when they closed back in December, because people have been trying to find other ways to operate. And these are really important conversations that we need to have through these types of webinars. It's not just about the health elements that Gemma's talking about. This is about how fundamentally does our high streets operate, moving beyond the COVID period. And we've got to start that dialogue really through these types of webinars and get to the sense about how we make those things happen, make them work more effectively. Gemma's already talked about changing rooms. You know, there will be a lot of people who will be quite uncomfortable at operating a changing room, will not have the capacity to have to run a changing room. Is that what you want to do straight away? Is there a different way that you could do that in the early weeks until you're comfortable with operating a changing room in the manner that you're talking about? Because it may just not be feasible. There are many changing rooms that have got nothing more than a curtain between each of the cubicles. That might be something which is something that you need to really start thinking about. So all of these different elements are vitally important, aren't they, in terms of this conversation, and that's why it's a different conversation to supermarkets and a very different conversation to hospitality and personal care. And I'm sorry I'm going on a bit, but if we don't answer some of these elements around click and collect, diversification, how we manage the public realm in a competing and busy high street, how do you do all those things differently, then I think we could face some real challenges in what and how our high streets operate after the 12th of April.
Thanks, Jonathan. Salesh, does that answer?
Yeah, I've seen some of the comments that people made that there might be some which are actually watered down because that's what the instructions are. But the ones I've come across was so obvious because like there was an adjacent bottle in a supermarket. I won't mention which supermarket it was, and that was very viscous. Exactly the same brand, same container, but the other one was very watery.
Yeah.
Salesh, can I just make a suggestion? If there's anything like that you want to draw our attention to, you can get in touch with us. I'll put an email address in the chat and we can help support that. I think it's just about educating supermarkets, because obviously if they haven't quite managed their stock properly of hand sanitizer, or or any retail premises of hand sanitizer, I think it can just kind of you just sort of panic and water it down. But they need to understand that obviously that would then reduce the alcohol content of the hand gel and it wouldn't work, so it's almost redundant. So I think there's an educational side of it that could happen, and if you do need our support with that, then please just get in touch and I'll pop my the email address in the chat.
Okay, wonderful, thank you.
Thank you. Thanks for the questions.
Cheers, no problem.
So moving on through the list, unless there's any additional questions from the floor, and there aren't at the moment. In terms of the NHS test and trace QR posters, are they relevant at all for retail, or for some bits of retail?
I don't mind starting. So with regards to the QR posters, and also just test and trace in general, aside from betting shops, I believe that the test and trace responsibilities, you don't have to collect customer details of those entering your store if you are a retail premises, mainly because it can be that you're sort of in and out, and there's lots of customers and things like that, and lots of kind of flow through. So I would say you don't need a QR code if you're a retail premises, and you don't need to be taking down customer details. One thing I would encourage is thinking about your staff. So I think keeping details of staff that have been on shift, and really keeping a kind of track record of who's been working in your premises, and certainly keeping hold of that for 21 days is really crucial. Obviously, if a member of staff becomes positive, then you can do that kind of contact tracing and ask those members of staff who've been close contacts to isolate straight away. Just on that, I would encourage, if you are aware of a positive case of COVID, and you can email us at the address I'm just about to put in the chat, to let us know at Public Health, and we can support you. But we would ask you to contact trace sort of as quickly as possible. And if you've got those staff rotas, you can do that straight away, rather than relying on NHS test and trace, which may or may not work, or may not be quick enough. So just really encouraging you to, empower you to do that. And I'll put that contact email address in just now.
Thanks, Gemma. Paul?
Yeah, just following on from that, I've got a question for Gemma actually that's just come up regarding the test and trace. Obviously, appreciate this is regarding retail, and previously we've done stuff for close contact, etc., barbers and things like that. And depending on what the retail is, would it be best practice for certain businesses maybe to do test and trace register? And I'm thinking of, at the top of my head, bridal wear, where you're actually doing dress fittings, where you're close contact with the person when you're doing it and things like that. Would it be beneficial for those type of businesses where there is a close contact to actually keep a register of the public that come in for those sort of activities?
Yeah, I think that's an excellent point, Paul, that you've raised. I mean, the guidance has been refreshed today. It's got today's date on it, so I'm sure there will be other premises in retail that it comes out that maybe contact tracing and QR codes would be more appropriate, and not just betting shops. As Paul said, you know, people spend a long time in bridal wear shops and can, you know, be there for many hours, and it's just kind of a close knit of customers. So yeah, absolutely, if it's prudent and you feel that, then please generate the QR code, and please do so, and do take people's details down and keep them for 21 days. I think you're really right there, Paul. I expect we'll see more retail premises coming out with that requirement, I would imagine.
Thanks. And Henry?
Yeah, just to expand on that, I think things like tailors, dress fitters and all of those were deemed close contact services originally, so they would require to be test and trace as part of the original HSE guidance. So although they're retail premises, if they are doing dress fitting or tailored measure suits and things like that, they would be deemed close contact and need to do the test and trace.
But in terms of the QR code, is it only betting shops that are mandated to display it among retailers?
Under the current retail guidance, yes, but then because the tailors or anybody doing close contact services would fall under close contact services, they would require to be a test and trace as well.
Yeah. Thank you.
I'll just throw one other thing on that. Please, anybody who's running those type of premises that we talked about before, whether it's bridal wear or tailors or people who are doing those kind of fittings, please maintain the pre-booking arrangements that you have put into place, because that actually provides you with the customer's details anyway, regardless of whether you're using the QR code or otherwise. But those pre-bookings, and build yourself enough time around those pre-bookings so that you can properly clean areas, etc. Often we found with some of the premises is the bookings are so close to each other, then people are having to wait because there's not enough time to do some of that really important hygiene arrangements in place. So pre-booking as much as you possibly can for those types of premises.
Thanks, Jonathan. And Gemma, you've just posted the dphadmin@warwickshire.gov.uk for those public health related inquiries and reporting any cases. If you have a question that's not related, you think, to public health, you can send it to business@warwickshire.gov.uk and we'll forward it on to the right people. That's been posted in chat there as well. So in terms of getting ready for next week, obviously there's 3 days left after today, if you count Sunday. Is it okay to bring staff in to get the store premises ready prior to the 12th?
I'm happy to kick off on that one. Again, we would absolutely encourage people to do that. There's obviously things like stock taking you'll need. I'm sure people are already well in hand of. I know a number of non-essential retail have been doing regular stock taking anyway over the last few months. But yes, you know, familiarising your staff again with how you're going to operate, the systems you're putting into place, the requirements, both in-store and outside the store in terms of how you'll manage. As I said before, if you're doing things like click and collect and you're looking to continue with that, how will that operate with other visiting customers? So think about all those things as part of that new model. Talk about with staff about how that'll operate. Great idea to bring them in early. Really valuable to bring them in early as well, just to assess people's health and well-being, because obviously you know the importance of your staff and making sure that they're comfortable with the arrangements and how they'll deal with some of the issues. Even some of the points that Salish was saying earlier, you know, if someone comes in without a face covering, you know, how will staff deal with that in a way that doesn't put themselves at risk? So all those kind of elements are really important to do. We'd very much encourage it. I was going to pose a bit of a question, Ian, if you don't mind, or just to get a view from Henry and Helen and Nicola, just to give a bit of a view on how they think that their town centres that they operate in within Rugby and in Stratford and Warwick, how they see things will look after the 12th. any issues that they think might arise that people ought to be thinking about, because they're different in their own very individual ways, and it might be nice to hear a sense of how they think some of the challenges and things might be dealt with or might arise next week. Sorry to interject, but it might be good to hear from the three of them.
Ian, if I could just come back on a very quick point before you just move on to that, with regard to what Jonathan said about people coming in early, etc., to the retail premises, can I just make a plea that if those staff are publicly visible within that store, that it is clearly displayed on the store that it is closed, because we will get calls from members of the public alleging that a shop is open that shouldn't be if they see people inside. So while they're doing that staff training, stock taking, etc., etc., please make sure that the closed sign is clearly visible for the shop for that, or even put a sign up saying staff training closed or whatever. But just to prevent those, those calls coming in that are unwarranted. Thank you. And sorry to interrupt, Jonathan.
That's an excellent point, Paul. Thank you. In terms of Jonathan's ask to the three towns, Helen, you had your hand up, I think.
Yeah, I mean, based on last year, a lot of the complaints that we dealt with in Stratford was about queue management, particularly outside of stores. I mean, I'm not aware if Rugby and Warwick had similar issues, but Stratford, particularly the high street, is quite small. So I would definitely think about where you're putting your queue outside, maybe checking with stores that are located next to you to see which direction they're putting their queues in, just so that there isn't a crossover. I know in Stratford we were quite lucky that they managed to close one of the main roads, which allowed more space for pedestrians, which definitely helped. And people putting markings on the floor, we're definitely encouraging people to do that, just so that you can manage those queues.
Yeah, thank you.
Shall I go for Warwick District? Parade remains closed to traffic. We have engaged, I think, 7 COVID marshals, COVID rangers that will be operating in the 3 towns, highly visible with jackets, and they'll actually be sort of helping to manage queues, also to distribute face coverings and little bottles of hand sanitizer is what we're hoping to do as well. So I'm hopeful that we'll be able to facilitate those persons that have come into town to get a bit of retail therapy that have forgotten to bring the prerequisite items, that we'll be able to ensure that people are able to go about their business in an easy manner. But much like Helen, Warwick District, the biggest concerns we had was queue management, particularly in areas where we've got pedestrianisation. I'm thinking of Kenilworth, Talisman Square, where we've got a number of queues that were trying to cross each other. So it's really a plea to talk to your neighbours and come up with some sort of workable solution in terms of queue management. We're looking forward to seeing everyone back in the district doing their shopping in person rather than at the supermarkets or click and collect.
Yeah, no, absolutely.
Want me to just touch on rugby? So rugby, we're quite lucky. We've got quite an interspersion of our retail premises throughout the town. So we're quite lucky with regards to queue management and things like that. And a number of our independent smaller shops, they have quite a big footfall, are looking at utilising. I'd still utilise, your other means of shopping, so don't necessarily just rely on footfall from people coming in. Still utilise those other areas of how you can look at shopping. We work closely within the town centre with our bid team. So anybody in the town centre who's signed up to Rugby First can get a free patch from Rugby First on how to, which provides you with signage, sanitisers, floor stickers. So I would encourage all of the rugby businesses to contact the Rugby First and to get yourself a pack. And obviously the town rangers, the bid rangers, will be out and about and there to help and assist, provide advice and guidance, as well as our community wardens who will also be doing patrols. So hopefully we will also have the markets back on in the town centre on Fridays and Saturdays. So they'll be recommencing at the end of next week, which I appreciate causes a little bit more footfall. So those businesses surrounding the markets need to manage their how they're queuing and how they're having flows into customers, as the markets are also doing with their customers and their traffic, and they've got their procedures in place as well. So hopefully Friday, Saturday, when we've got the market back, will look like a slightly more bustling town centre, and we'll get a bit more footfall into the town centre for all of our retail businesses, and we're supported by hopefully some of our hospitality businesses as well, who hopefully have some customers sitting outside on the pavements drinking their coffees and coming into your shops. And I'm looking forward to it.
Great, thanks all there. Jonathan, did you want to come back on that?
Yeah, I just think that was so helpful to hear from Helen, Nicola and Henry on those issues. And I think, again, it just highlights, isn't it, the importance of really putting in some time very early on. I know a number of businesses, when it comes to click and collect, for example, operated those outside of their normal busy times of their business just to keep the flow going. So having the click and collect at the beginning and the end of the day made life a lot easier for them. Something definitely to consider, particularly in the busy high street areas that have been mentioned. But also, huge encouragement, if I could please, to anybody who's listening to this webinar and you're running a business in any of those areas, please actually visibly walk outside of the premises and talk to your neighbours. I don't think we can emphasise that strongly enough. If you're a business that is going to have a queue, even if it's a small queue, and you've got shops either side of you that are similar, as Henry is saying, what you don't want to have is lots of people then competing for the same space on the pavements, on the areas outside of the premises, and causing further issues. So, visibly walk. I know the Leamington bid, for example, walked their town centre and assess where they thought the pinch points might be. Do something similar for your own premises and talk to your neighbours. And work out between you how it can operate so that competition and some of those issues don't arise.
Thanks, Jonathan. And Paul, you had your hand up.
Yeah, just I suppose really from a county perspective, from a policing side of things, I just thought I'd highlight some of the calls and issues that are usually raised with us that happened obviously last time retail opened up again, but has happened throughout the whole of the pandemic in different types of retail. So the sort of calls that we get, so businesses can look at them when they're opening up and try and prevent these sort of things happening. We've already mentioned face coverings. That's a regular call we get about staff and customers. We've had calls before where premises have staff huddles before they start and open up and things like that, and people will report in there's 6 or 7 people huddled together closely, not social distancing. General calls about no social distancing with inside retail premises where people have gone in, they felt uncomfortable because of lack of social distancing, too many people in the store, etc, etc. Same sort of issue with regard to queue management and social distancing outside the store. We've had those sort of calls. We get calls about people not offering hand sanitizers on entrance and things like that. One of the signage, we get calls about shops not displaying signage, i.e. wear a face covering, etc, or whatever that may be, as such, or the signs not being big enough for people to read. And one of the other things that we do get calls about, where we ask, and I know General and Public Health would be really strong on this as well, where staff are close contacts and need to self-isolate, please make sure you support those staff in doing so, because we will get calls where, call it a whistleblower, whatever you might call it, sort of thing, where there is a positive case within a retail outlet and other members of staff who were close contacts are not isolating. It's really crucial that they do, and the email addresses have been put on the site. If people have concerns and don't know, contact those email addresses and ask those questions, because it's really important better to be safe than sorry. And the last thing we want is police coming knocking on shop doors because someone's not self-isolating when they should do anything like that. So it's a real public health one, that one, but it is really crucial as well, and we do get calls about it. But that's it. Thank you.
Thanks, Paul. And I'd like to make a quick mention. Jonathan's talked about staff well-being, and I think Gemma may have touched on that as well, but The Coventry, Solihull, Warwickshire COVID Business Pledge, which is formally launching later today, is an opportunity for businesses to display a poster and show that they're committed to all of the things we discussed today, around social distancing, hygiene, face covering, ventilation, testing, outbreaks, vaccinations, and staff health and well-being. And by signing up to the pledge in Warwickshire, SMEs can access employee assistance support. So free of charge, the business is registered and they can offer this support to their staff. It's an online resource and a telephone line, and it helps with concerns about money, family issues, and general mental health issues. It's an extra amount of support that you can offer to your staff at this time. So we'll put a link to that in the video that goes online either later today or early tomorrow. Okay, so conscious of the time, I don't see any additional questions in the chat or any hands up. Were there any final comments or questions?
I think my only final comment, I think, for all of us is we wish all of the premises reopening next week the very best. We hope it goes really well. We are here to help. There's lots of contacts you can make to us and lots of support we can offer. And I think we all genuinely hope that this is the last time we'll be having a conversation about easing out of lockdown. So from all of us, best of luck and best of wishes for next week.
Yeah, thanks, Jonathan. Aaron?
I'd just like to agree with Jonathan there, and also we mentioned bids earlier. There are other local providers of services, sort of the chambers of trade, etc., or even small trader groups that are within the town centres themselves, so they can also give a shout out to all of your friends, all of your fellow colleagues and shops, because we're all in this together. And just like Jonathan's just said, it's all about that not having to be here again. This is the last time we can hopefully do this. So absolutely, the whole town centre, the whole high street, the whole little market centre, we're all in this together. So if we can all do it, we can all have the same rules and regs, we can get through this.
Yeah, and even more so than normal, it's a good time to shop local. So we're all looking forward to getting back into your stores. So all the best, and thank you very much. As I said, we'll just put some useful links up now, and this video and other similar videos are available on the Warwickshire County Council YouTube channel. We've got the link to that. You may have to search for specific webinars, but they're all up there. So thanks to our panel for your time and preparation this morning. Thanks to those who've joined the call, and do please share this with your colleagues and contacts. I'm sure they'll find it useful. And thanks very much all.
Thank you.